COVID numbers here in Illinois include declining case counts and positivity rates.
So here are the numbers for today from the public health officials. They announced nearly 5,000 confirmed and new and probable cases. Another 123 people in our state lost their lives, though, to the virus, including a woman from Coles County in her 20s. The 7-day average case positivity rate fell once again to 5.4%. And as the state eases COVID restrictions in some counties, the city of Chicago is preparing to move to the next phase of the vaccination plan.
That will expand the availability of the vaccine to people 65 and older, along with some essential workers. WGN's Mike Lowe is at a pharmacy in North Center with more. Mike?
Ben and Lourdes, good afternoon to both of you. When Chicago moves into that next phase of the vaccination plan, we will not see people in long lines waiting to get the vaccine. If you're going to get it here in Chicago, you are going to need an appointment, whether that is at your doctor's office or at a local pharmacy like this one.
It's really critical that everybody get their second dose of vaccine on time.
Chicago Department of Public Health Commissioner Dr. Allison Arwady received her second shot of the Pfizer COVID-19 vaccine today at Harry S. Truman College in Uptown, one of the city's points of dispensing, or pods.
Yeah, all right. Thank you kindly.
Chicago is preparing to move to the next phase of its COVID-19 vaccination plan on Monday.
We will be formally starting to move into phase 1B.
The next phase will allow Chicagoans over the age of 65 and a specific group of essential workers to receive the vaccine. Phase 1A will also remain open, allowing for healthcare workers and those in long-term care facilities to continue to get their shots.
Every dose of vaccine in phase 1B will be given by appointment. You cannot show up at a pharmacy, at a point of dispensing, at a doctor's office, and think that there is going to be a line for getting vaccine. I know that you've seen pictures of that in other places around the country. That is not how we are organizing our vaccine here.
In Chicago, there will be 4 ways to get the vaccine. The vast majority of people will get it through their own doctors. A second option is to make an appointment at a pharmacy. Third, there will be several pods or mass vaccination sites like school gyms and community centers. And fourth, some people will have the option of taking it at work. The vaccine is trickling out slowly, and Mayor Lori Lightfoot is urging the federal government and pharmaceutical companies to ramp up production.
The biggest challenge that we face right now is really not having enough vaccine.
The city has received between 32,000 and 34,000 doses per week for the last month. To put that in perspective, there are 360,000 Chicagoans over the age of 65 and some 300,000 essential workers.
The amount of vaccine that we are getting each week right now will allow us to vaccinate 5%, 1 in 20 of the people who are eligible.
Across the state today, officials reported nearly 5,000 new cases and more than 120 deaths. The Illinois Department of Public Health announced it would ease certain COVID-19 restrictions on Will and Kankakee counties. That will allow restaurants and bars in the region to start serving indoors with capacity limits. Illinois Department of Public Health data show the average number of daily vaccinations is declining from more than 27,000 on January 14th to 22,500 on January 20th. Today, Governor J.B. Pritzker joined with 6 other Midwestern governors.
Let's get it done.
In releasing a video encouraging people to make a plan to get vaccinated.
But I know we're all up to the task.
I want you to understand it is likely to be a number of weeks before you are able to receive vaccine.
And in Chicago, Dr. Arwady has advice for the thousands of people waiting for a shot in the arm. You'll also need a healthy dose of something else.
My main word for you is patience.
Indeed, patience will be critical as we are expected to see these doses doled out over the next series of months and not really the next series of weeks. The state's positivity rate stands right now at 5.4%. Things are heading in the right direction, but health officials say in order to avoid another surge, what we really need to do are keep taking the basic public health steps such as wearing masks in public, keeping your social distance, and of course, washing your hands.